Wangui, Kinyua. Welcome to the Crown Africa Network. This program brings you to light with the most evocative issues affecting the public globally in education, arts and culture, science and technology, and politics. Let's begin. The government of Ireland has finally legalized abortion in the country 6 years after the face of the petition. Sativa Halapanava died from an infection, miscarrying her first child in Irish hospital. They said she pleaded for a termination during the miscarriage, but medical staff refused because there was a fetal heartbeat. This was due to the Irish law that gave the fetus equal rights to the pregnant mother. The fourth man to walk on the moon, former US astronaut Alan Bean, dies at the age of 86. According to his family, Mr. Alan died peacefully at a hospital in Houston. He spent his later life as an artist producing paintings that were inspired by space. May his soul rest in eternal peace. Rape cases have increased by approximately 36% in the last year. An 8-month-old baby has been raped allegedly by his cousin in Delhi. In a related case, a 22-year-old woman was pulled out of the car and raped in front of her husband and brother-in-law, while in America, an 18-year-old girl was raped by a police officer who pleaded not guilty in court. At least 4,000 rape cases are reported in a week. I can see Twitter is hitting up. We have Eve Carlos saying, "I can't believe someone would do this to a child. This is so wrong." Right now, ladies and gentlemen, I'd like you to join me as we discuss the dangers of abortion, where we stand in accordance to the law, what are some of the passes in regards to abortion. My correspondent African Jogu did a research on the issue of abortion. Let's take a look.
Abortion has been a topic that is mostly slept on and ignored. This doesn't overlay the fact that it is one of the many killing factors of our young girls today. Abortion is performed in the dark corners of the night by unskilled medical staff that are in it for the money. We have proven that the abstinence sermon does not help, that it falls in deaf ears. Every day, either a dog finds a baby in the trash or someone finds one in a latrine, or better yet, a girl bleeds to death. How long are we going to keep silent as we watch the erosion of a new generation erode to nothing? Do you think abortion should be legalized?
Now, African, do you think abortion should be legalized?
Yes, Wangui. I think abortion should be legalized for the very reason that it has put a lot of girls in danger. Lots of girls are trying to look for places that are not safe for them to carry out the act. And if it is legalized, then very many people will be able to go to hospitals. They'll go and take the right procedures that are healthy and are safe for them to have the abortion. But if we do not legalize it, then it puts many girls at risk and puts many babies at risk. Therefore, abortion should be legalized just for the sake of the safety, for the sake of safety of the girls. Yes.
Very informative information there. Thank you, African. But first, let's take a break. Don't go too far. Reading from Twitter, we have Eve again, who says, "I love your show, and yes, I think abortion should be legalized. It's a woman's right." Welcome back to Crown News Live. And of course, before we took a break, we were talking about the issues of abortion. Please join us in the crucial discussion. Don't forget to tweet us at Wangui Kinyua on Crown News Live. But at this moment, I would like you to join me as we introduce my guests. First up, we have Nurse Esther Juma from Bliss Healthcare Center. Welcome, Nurse Juma. And next, we have her colleague, Dr. Alice Mwendwa, who also works at a Bliss Healthcare Center. And finally, we have Dr. Alice Nzagi, who is a psychologist by profession. Welcome and thank you for joining us. I'd like to kick off this discussion with Nurse Juma. Nurse, in your experience in the practice, do you think abortion should be legalized?
Actually, personally, I don't think that abortion is right, and legalizing it is it's not the good thing to do. But if it's medically approved, I just think it's fine.
Right, and what are some of the advices you would give to such patients before they think about abortion?
First advice I'll tell the patient is the effect of abortion, which can affect the person either physically, emotionally, or psychologically. So I'll have to give the client actually the real view and the real side effects of abortion, so that whatever she wants to do, let her do it under her own risk.
And Dr. Lisa, I think this question is more appropriate to you. Do you think there's stigmatization with the patients who choose to perform abortion, to go through rather with abortion?
Well, my answer varies there because I have to approach each patient personally and listen to the reasons and assess the medical posture of the patient. We have patients who are led to wanting an abortion because of depression, or maybe the baby's father left her. So such patients, I would calm them down and advise them to instead deliver the baby and maybe opt for things like adoption, because abortion is also risky in some way, because we're not always sure that it will go well, and this is murder as much as we look at it. So whatever the reason, I'll handle it as it comes. But if it is medically dangerous for you to keep that baby, then I'll advise you on the options we have.
Dr. Alice, I would like to ask you this question. What are some of the psychological effects of abortion?
All right, Wangui, I would also want maybe to make a clarification here. When we talk of abortion, sometimes and to most people it just means the induced termination of a pregnancy by the person. But actually abortion, it also means the natural termination of the pregnancy. So if we are talking about natural termination, of course, one of the psychological effects is that somebody will most likely grieve because it's a loss. So they'll be grieving, and the grieving will come with different symptoms. You'll find that there are some people even who may still be feeling they're pregnant. Others, of course, there's sadness. Others, they may even start hearing a baby crying, or even the movement of the baby, depending on at what stage the abortion occurred. And so there are all those effects.
Right, and how do you help the people who have done or performed abortion already to cope with what they've done?
All right, when we talk about coping with the environment, I would first find out what is the problem with her. Is she at that point that she's feeling that she did something wrong according to her values? Is it that when she did the abortion, that led to other physical problems, and now the problem she has is the physical? Is it psychological symptoms like guilt now and sadness? So I have to find out what is her problem. What is her problem? And in either case, someone can be assisted. So if it is the sadness, the guilt, the suicidal, then that means she's experiencing depression, which is traced way back to that act. And now in that, I'll use therapies which will help her now to get out of the guilt and be able to know that she did something wrong and something which is making her feel sad, and now she wants to get out of it, and then finds a better way of coping with the situation. Now that she did it, it cannot now come back again because she did it. Maybe again, it could be a situation she has found that because of it, she can never give birth. So you see, there are all these dynamics. So I have to know, I have to get what is the situation, what is the problem, because different people, they may express it differently, and each person is unique. Yes.
And right, and do you offer counseling to the rest of the family members of the patients?
Definitely. if they want or they volunteer to seek for help. So like, let's say for instance, let's say the abortion was self-induced, right? And the family members, they are found out, and this is causing a lot of turmoil in the family or within the family members, and they have sought for therapy. They can be helped, or if the individual herself, the situation is unbearable at home, and she's depressed, and maybe the members of the family, the rest of them, they are up in arms, and she's finding the home not a conducive place, and she comes to seek for therapy. Yes, we can help her, and then we can also request her whether she would propose to the family members, or we can propose that the family members, if it is possible for them to come, they need also therapy, so that when she goes back home, at least she finds a place she's understood, and a place she can be able to recover from, she's recovering. Or if it was natural also hurts. So if it happened by itself, I'm just imagining that family, possibly it was a husband and a baby or two babies and the mother. So these are the two babies, they are really waiting for their baby brother, baby sister, and all of a sudden baby brother, baby sister is not coming. So the whole family is affected. So if they volunteer for therapy, we can help them. And most of the cases, when it's the wife who has come, we also make that proposal, and she may feel the need, and also she may contact with the husband. Sometimes they come both, and also we propose that also we recommend that the children also requires therapy, because they were waiting for baby brother or baby sister, and it's not coming, and possibly they are even at an age they can't even understand what is happening. So they also grieve. So we walk with them through the grief and help them to deal with it.
Those are some very strong comments right there. And before we leave, I would like to say that abortion is a mother's choice and should be legalized. And I would like to thank my guests for joining us. And to you, my audience, thank you for tuning in. See you next time.